What if I told you that scrolling on Facebook could be the exact prescription you need to lose 50 pounds? I know, it sounds ridiculous. We are constantly told that social media is making us lazy, depressed, and inactive. But a team of doctors at a major medical center decided to flip the script. They wanted to know, could the most addictive digital platforms on Earth be weaponized to make you healthy? Think about the last time you tried to lose weight. You probably had a burst of motivation. You threw out all the junk food in your pantry. You bought some expensive running shoes. You promised yourself that this time would be different. And maybe it was, for a week, maybe even a month. But then life happened. You had a stressful day at work. Your kids got sick. You went to a birthday party and had one slice of cake, which turned into 3, and suddenly the guilt sets in. Before you know it, you are right back where you started. Or worse, you actually weigh more. If this sounds familiar, I need you to listen to me very carefully. It is not your fault. The global medical community has known for decades that standard diet and exercise advice simply does not work for the vast majority of people over the long term. Giving someone a diet plan is easy. Getting them to stick to it when the motivation fades, that is the hardest puzzle in modern medicine. But a team of researchers at the National Taiwan University Hospital thinks they might have found the missing puzzle piece. In the clinical trial, these doctors didn't test a new miracle pill. They didn't test a new gastric bypass surgery. Instead, they tested human nature. They designed a 2-year randomized control trial to see if combining traditional weight loss methods with the raw, addictive power of a social networking site, specifically a private Facebook group, could create an unbreakable system for permanent weight loss. Could the very technology that keeps us glued to our couches actually be the cure for the obesity epidemic? Today, on Clinical Trials Explained, we are going deep into this fascinating study. We are going to look at the massive psychological barriers to weight loss, the brutal standard intervention these patients were subjected to, how the researchers used social media to hack their brains, and what this means for the future of healthcare. Let's get into it. To truly understand why this clinical trial is so incredibly important, we have to take a step back and look at the brutal reality of obesity. Let's use an analogy. Imagine your body is a high-level corporate accountant, but this accountant doesn't work with money. He works with energy, calories. For hundreds of thousands of years, humans lived in environments where energy was scarce. We had to hunt, forage, and survive harsh winters. Your biological accountant was trained to be extremely stingy. Anytime you found extra calories, the accountant would lock them away in a secure vault, your fat cells, for a rainy day. If you started losing weight, the accountant would panic. He would sound the alarm. He would flood your brain with hunger hormones like ghrelin, making you obsess over food, while simultaneously slowing down your metabolism to preserve every last drop of energy. Now, fast forward to today. We live in a world where you can get a 1,000-calorie burger delivered to your front door by tapping a piece of glass 3 times. But your biological accountant, he hasn't updated his software. He still thinks a famine is coming. So when you go on a diet, you are not just trying to lose a few pounds. You are actively declaring war on millions of years of human evolution. And traditionally, how has the medical system helped you fight this war? They give you a pamphlet. Seriously, the standard of care for obesity for decades has been a doctor looking at a patient, handing them a piece of paper that says, "Eat less and move more," and scheduling a follow-up appointment 3 months later. This is the equivalent of dropping someone in the middle of a dark, terrifying jungle with a poorly drawn map, no compass, and saying, "Good luck, see you in 90 days." It's no wonder people fail. Weight loss is an incredibly dynamic, complex process. It involves your behavioral habits, your physiological hormones, and your socio-environmental factors. In other words, the people you hang out with, the stress of your job, and the layout of your local grocery store all impact the number on the scale. So, scientists realized they needed a multifactorial approach. They needed a way to be in the jungle with the patient every single day. Enter the National Taiwan University Hospital. These researchers realized something brilliant. Where do people spend all their time? Social networking sites, SNS, platforms like Facebook. What if we could take the digital village of social media, strip away the toxic politics and the fake news, and replace it with a hyper-supportive, scientifically backed ecosystem? Let's break down exactly how this trial, the SNS-based weight loss behavior intervention, was designed to work. First, the researchers needed to find the right people. They recruited 72 adult patients, aged 20 to 64, from a weight control clinic in Taipei. These weren't just people looking to drop 5 pounds for a beach vacation. These were clinically obese individuals with a body mass index, or BMI, of 27 or higher. But the researchers had to be careful. They put some strict exclusions in place. If a patient was pregnant, they were out. If they had previously been diagnosed with diabetes, they were out. Why? Because diabetes drastically alters how the body processes insulin and sugar, which would skew the baseline data. They also excluded anyone with a history of psychosis, severe anxiety, major depression, or clinically diagnosed eating disorders. This is a critical point. Weight loss interventions can be incredibly stressful on the mind. The researchers needed a relatively stable baseline of mental health to ensure the intervention wouldn't trigger a severe psychological crisis. Lastly, no history of surgical weight loss and no alcohol or drug abuse. Once they had their 72 participants, it was time for the sorting hat. The patients were randomly divided into 2 parallel groups. Let's talk about Group 1, the control group. This group received the standard intervention. But do not let the word standard fool you. This protocol was incredibly strict. Imagine you are in this group. You walk into the clinic and the interventionist sits you down. They put you on a heavily reduced calorie diet, and it's not a guessing game. It is mathematically prescribed based on your baseline weight. If you weigh less than 90 kilograms, about 198 pounds, you are allowed 1,200 calories a day. Let me pause right there. 1,200 calories is tiny. For context, a single meal at a fast food restaurant can easily top 1,500 calories. 1,200 calories a day requires massive cognitive restraint. You are measuring every grain of rice. If you weigh between 90 and 115 kilograms, you get 1,500 calories a day. And if you are over 115 kilograms, about 253 pounds, you get 1,800 calories a day. The doctor gives you some sample meal plans to make this easier, but the hard part is just beginning, because now you have to exercise. The interventionist prescribes non-supervised moderate to vigorous physical activity. You have to start at 100 minutes per week. That's about 15 minutes a day of sweating, heavy breathing, heart-pumping work. And every 4 weeks, the goalposts move. You have to increase your exercise time until you hit 300 minutes per week. 300 minutes. That is 5 solid hours of intense physical activity every single week. Nearly 45 minutes a day, every day. Remember, these are people who are clinically obese and likely haven't exercised consistently in years, and they have to do this all by themselves, non-supervised, in the real world. Are you starting to see why standard interventions fail? The willpower required to maintain a 1,200 calorie diet while exercising 5 hours a week in total isolation is superhuman. Now, let's look at Group 2, the experimental group. These patients had to follow the exact same brutal diet and exercise guidelines as the control group, but they were given a secret weapon. They received the enhanced intervention. The researchers created a completely private, locked-down Facebook group. Only the study staff could invite you. It was a digital safe haven. In this group, the interventionists, the actual physicians and registered dietitians, acted as health coaches. Every 2 weeks, they would drop evidence-based topics related to weight loss right onto the Facebook discussion board. But it wasn't just a digital textbook. It was an interactive, dynamic, personalized feedback loop. Think of this like having a doctor living in your pocket. If a patient was struggling with a craving on a Tuesday night at 9 p.m., they didn't have to wait 3 months for their next clinic visit. They could open Facebook, see the posts from their health coach, and interact with other participants in the exact same boat. This tapped into an incredibly powerful psychological concept, social proof and peer accountability. When you are trying to lose weight alone and you eat a donut, nobody knows. The only consequence is your own internal guilt. But when you are part of a tight-knit community sharing your daily struggles, you feel a sense of duty to the group. You see someone else post about how they successfully completed their 45 minutes of exercise that day, and it triggers a healthy, competitive inspiration. The researchers weren't just guessing here. They knew that if they could keep the patients actively engaged on a platform they already used every day, they could massively reduce the attrition rate, which is a fancy scientific term for people quitting. But how do you measure success in a trial like this? Obviously, the primary outcome is weight change. The researchers put the participants on the scale at week 4, week 8, week 13, halfway through the year at week 26, the 1-year mark at week 52, and then kept tracking them all the way to week 104, a full 2 years. Tracking for 2 years is incredibly rare and highly valuable in clinical trials. Most studies only last 12 to 16 weeks. Why? Because anyone can starve themselves for 12 weeks.
The real test of an intervention is whether the weight stays off 24 months later. But here is where the trial gets incredibly fascinating. The researchers didn't just care about the scale. They knew that weight is a lagging indicator of behavior. If you want to understand the weight, you have to measure the mind. So they introduced 3 massive secondary outcomes, heavily relying on deeply psychological questionnaires. The first was the TFEQ-R18. This stands for the 3-factor eating questionnaire. It measures the participants' eating behavior across 3 distinct pillars: cognitive restraint, disinhibition, and hunger. Let me explain these because they perfectly describe the psychology of dieting. Cognitive restraint is how hard you are mentally trying to restrict your food. Disinhibition is the screw it effect. Have you ever eaten a single French fry, felt like you ruined your diet for the day, and then decided to just eat a whole pizza because screw it, I'll start again tomorrow? That is high disinhibition. And hunger is exactly what it sounds like, your biological susceptibility to feeling starved. By measuring the TFEQ-R18 at 6 months, 1 year, 1.5 years, and 2 years, the researchers could see if the Facebook group was actually changing the way patients thought about food, rather than just forcing them to restrict it. The second measurement was the BSRS-5, the Brief Symptom Rating Scale. This is an assessment of psychological distress. Dieting makes people miserable. It causes anxiety, it causes mood swings. The researchers wanted to know, does standard dieting cause high psychological distress? And does having a Facebook support group lower that distress? If the score is high, the patient is suffering. If it's low, their mental health is stable. The third measurement was the CIA 3.0, the Clinical Impairment Assessment. This measures your overall quality of life. Does your weight or your diet stop you from hanging out with friends? Does it affect your performance at work? Does it make you want to hide in your house? The hypothesis here is absolutely beautiful. The researchers theorized that compared to the lonely, grueling standard intervention, the enhanced Facebook group wouldn't just result in greater weight loss. They hypothesized it would improve health attitudes, increase health literacy, lower psychological distress, and ultimately stop people from dropping out of the program. So, what happened? This clinical trial officially wrapped up its data collection in July of 2020. However, the final peer-reviewed results have not yet been publicly posted to the registry. But as clinical strategy analysts, we can look at the mechanics of this study and immediately see the profound what-ifs. Imagine the data. What if the control group, the folks who were told to eat 1,200 calories and exercise 5 hours a week in total isolation, saw a 60% dropout rate? That wouldn't be surprising at all. It's human nature. Now imagine the experimental group. What if the simple act of having a private Facebook group, getting personalized digital feedback from a doctor, and sharing the struggle with peers reduced that dropout rate to 0? Think about the psychological shifts. Without social support, a single bad day of eating causes massive disinhibition. You eat the pizza, you feel ashamed, you quit. But in the Facebook group, you eat the pizza, you feel ashamed, but then you log on and see that 3 other people also slipped up that week. The doctor, acting as a health coach, chimes in and says, "One bad meal doesn't ruin a month of progress. Here is a strategy for tomorrow." Suddenly, the shame is gone. The isolation is broken. You get back on the treadmill the next day. This isn't just a theory. The digital ecosystem acts as a psychological buffer against the exact emotional triggers that cause weight regain. But we also have to look at the worst-case scenario. Is there a dark side to social media intervention? Could a private Facebook group create an echo chamber of negativity? If one prominent member of the group starts complaining that the 1,500-calorie diet is too hard, could that trigger a domino effect of rebellion among the other patients?
Does the constant reminder of weight loss on their social media feed cause them more psychological distress because they can never truly escape their diet, even when they are just trying to look at pictures of their grandchildren? These are the exact multi-level factors this trial is trying to untangle: the interaction between behavior, environment, and biology. Why does a study from 2020 in Taiwan matter to you right now? Because the entire global healthcare system is at a breaking point regarding obesity. Right now, the media is dominated by GLP-1 receptor agonists, drugs like Ozempic, Wegovy, and Mounjaro. These drugs are incredible. They chemically mimic the hormones that tell your brain you are full. But they have a massive, glaring problem. They are incredibly expensive, often costing over $1,000 a month. They can have severe gastrointestinal side effects, and worst of all, the data shows that when patients stop taking the injections, the biological accountant wakes back up. The hunger comes roaring back, and the majority of patients regain the weight. We cannot afford to put 1 billion people on lifelong, expensive injections. It will bankrupt the medical system. We need scalable, low-cost, permanent behavioral solutions. That is exactly what this trial represents. Setting up a private social networking group costs virtually nothing. Having a single dietitian moderate a group of 50 patients takes a fraction of the time compared to seeing 50 patients individually for 1-hour clinic visits. If this model works, it completely democratizes elite-level weight loss support. It means that no matter where you live, no matter your income level, you could be prescribed a digital community. Your doctor's prescription wouldn't just be a pill, it would be an invite link. It proves that we don't necessarily need to invent a new molecule to cure obesity. We might just need to reconnect with each other. We might just need to stop treating obesity as a personal moral failing and start treating it as a complex social challenge that requires a community to overcome. Because at the end of the day, human beings are pack animals. We survive together, and we heal together.
If you found this breakdown of clinical trial fascinating, you need to hit the subscribe button right now. Here at Clinical Trials Explained, we don't just read the headlines. We dig into the actual science, the protocols, and the psychology of the medical breakthroughs that are shaping our future. I want to hear from you down in the comments. Do you think you would lose more weight if you had a private Facebook group with your doctor and 30 other people on the exact same diet? Or would the constant notifications drive you crazy? Let me know your thoughts below. Next, we are diving into a highly controversial new trial. You are not going to want to miss it. Until then, stay curious, keep questioning the standard advice, and I'll see you in the next video.